Hello, welcome back to Midwife par excellence. I am so excited to see you all today. And today is especially a special day because we're celebrating a group of warriors that, trust me, they're fighting their good fight and they're doing it. They're doing it. All right. They're empowering themselves. They're being supported by us as the healthcare staff and family members and the populace on a whole. And I am so proud of them. All right. I also want to thank you for subscribing, for sharing, for commenting, recommending, and you're clicking the notification button. Therefore, you're up and you're ready for whenever the posts come. And we encourage you to continue tuning in to Midwife par excellence as we learn more and as we refresh many more topics so that we can all become aware of what is happening around us health wise. All right, so today, this week is being celebrated as Sickle Cell Awareness Week, and today, June 19th, is actually Sickle Cell Day. Today is the day that we spend the extra time to focus on our sicklers among us. And I always say, I salute you, sicklers. You're doing it. You're going above, you're going beyond, and you're fighting the good fight. And I must tell you, you guys are strong. All right. So, what really is sickle cell? Sickle cell is an inherited condition in which there is an abnormal shaping of the red blood cells due to decreased oxygen. All right. So, the average red blood cell, the red blood cell should be round in shape, but because of lack of and decreased oxygen, they become what we call sickled. All right, and sickled means looking like a crescent. So they now have a crescent shape, right? And because of this crescent shape, they tend to get really soft and sticky and they clump together. Now, upon clumping together, right, they block the blood vessels. And if you know anything about blocking a blood vessel, it's just as if you have a pipe and there's a stone in there blocking it. It cannot pass and it just stays there and it has an impact and it has an impact. And it's just the same thing as the sicklers. So these blood vessels are blocked and they are in never ending pain. They're always in pain. Another thing to note too, that because these sickled red blood cells have a short lifespan, so the average red blood cell should live for up to 120 days. The sickled red blood cells are not living more than 15, ranging about 15 to 40 days thereabouts. So you already realize that these clients are gonna have anemia because their red blood cells are not living the time that they should live. All right. So these are the two main conditions that are the sicklers have to be fighting: anemia and also never-ending pain. Now, this pain, this anemia, they can also end up with infections. All right, and the tissues that are dying around them, they can also end up with a stroke, as I had said before in a previous lecture, and many other conditions. All right, now with specific to pregnancy, I'm gonna be naming some of the impact of sickle cell disease on the pregnant woman. And you see, I always encourage my clients that when you meet a partner, you want to ensure HIV is important, syphilis is important. Also, the sickle cell status of both partners involved should be as important. So I encourage you ladies, I encourage you gentlemen, please know the status of your partner with regards to sickle cell. You need to know if the person has the sickle cell disease. You need to know if the person has the trait. Because of course, if the mother has the trait, the father has the trait, there's a 25% chance, which means that if they should have 4 children, at least 1 out of the 4 children will come with the sickle cell disease. So you see how important it is that you know your sickle cell status from the get-go. Now, if one parent has the trait and the other has a normal gene, the child will end up with a condition what we so commonly hear about, sickle cell trait. But in order for the disease to take place, either partners would have donated an abnormal gene. All right. Now, the impact of this sickle cell on the pregnant woman. Listen, increased risk of abortions. If you're having decrease in your oxygen carrying capacity, means that tissues are going to be dying. This woman will be grossly affected. Therefore, her likelihood of not bringing a pregnancy to term is greater. All right. Increased risk of infection. As I said before, these clients will continuously be having infections because of the dying of tissues and such the like. Urinary tract infections, and of course we said tissues. All right. Preterm deliveries. So these women, their bodies will be so grossly affected by this condition that they will be going into premature labor most times. All right. Risk of pregnancy-induced hypertension. So they develop blood pressure after 20 weeks after 20 weeks of being pregnant. It is likelihood the increased risk of developing pregnancy-induced hypertension in the pregnancy. There's also a risk of a condition called eclampsia, right? Coming from a condition called preeclampsia, where preeclampsia is a protein in the urine along with elevated blood pressure and swelling of the hands, limbs, or the face. Now, if preeclampsia is not sorted out, it will progress to eclampsia, which is the client having seizures in the pregnancy. So you see how important this sickle cell disease is. All right, there's risk of intrauterine growth restriction. So because there's not enough oxygen going to the baby for growth and development to take place, these babies tend to be smaller in size than the average baby at their age. All right. Risk of stillbirths. As I said, baby can be born dead. All right. Increased risk of cesarean section. So because these clients are already traumatized, there are times when they'll not be allowed to have a vaginal delivery, and hence the risk of having a lower cesarean section increased. All right. Also, and the one that we don't like to talk about, the risk of maternal mortality. The mother can die. I have seen it happen. All right. And so these clients in pregnancy, we prepare them for the inevitable. All right, because so many things can happen. And during labor, these clients, as we said, will always be having pain. So therefore, these clients will have the need for analgesia all the time. All right, these clients will be needing oxygen therapy. These clients will be on antibiotics continuously. All right, after delivery of the third stage, this is after the baby has been born, we have to monitor these clients closely. Because of their anemia status, they are prone to hemorrhaging. So the third stage of labor has to be monitored. Excessive blood loss has to be, we have to try and limit the amount of blood loss that these clients have. So you see how important this condition is to avoid, and how closely monitored these clients have to be monitored if it is that they are sickle cell diagnosed in the pregnancy. All right. These clients post-delivery will be introduced to a long-term family planning method. So family planning counseling would have started from pregnancy. All right. So afterwards, as soon as possible, most times around the 6 weeks post-delivery, they are introduced to a family planning method. All right, to prevent pregnancy from happening. Now, every baby that is born is screened for sickle cell. All right, every baby that is born is screened for sickle cell, and if it is that the baby has been returned as having the trait or the disease, the mother will, the midwife or the doctor will be notified, and then the mother is called in, a referral is given, and that referral is taken to the pediatrics unit, and continuous care is done afterwards. So I have to tell you that sickle cell disease, it is a condition that, and when I tell you that these persons are warriors, I have watched mothers in front of me fight for their lives after becoming pregnant as a sickler. And so I'm telling you, when you watch their success stories and they come out and the baby is okay, and they fight weeks, months after they've had their babies and they're still fighting, let me tell you, it is something to watch. So I hope my presentation today would have enlightened you, to the condition that we're talking about and that we're celebrating today as Sickle Cell Awareness Day today. All right, ladies, gentlemen, know your sickle cell status before you start having children. All right. I thank you again for sticking and staying here on Midwife par excellence. I look forward to seeing you each and every time. Thank you for subscribing. Thank you for recommending. Thank you for commenting. Thank you for sharing. Thank you for clicking that notification button so you're always on point when I do my posts. All right? Take the extra minute to subscribe. Share with a friend. And I will see you again real soon here on Midwife par excellence. I thank you.